infectious diseases, research, medicine, health. Welcome to Outbreak News Interviews. And now, broadcasting from the Outbreak News Skylar Studios in beautiful West Central Florida, here is your host, microbiologist and editor of OutbreakNewsToday.com, Robert Harriman.
South Africa just came out of a pretty large Listeria outbreak, sickened about 1,000 and killed more than 200. Pretty big outbreak. Dr. Gompf, what is Listeria monocytogenes? Who's most at risk? What's its pathology? And what are the common sources of this bacterium?
So Listeria is a gram-positive bacillus that is very hardy, and it's very common in many environments. And it can live in the cold, it can live in heat, it can live in very salty foods like deli meats, even in almost pure salt, and wet or dry conditions. So it is common in a lot of, in the U.S., a lot of food preparation areas, even with excellent sanitation. It has caused outbreaks related to fresh produce and dairy products, most especially in recent years, and from unpasteurized soft cheeses like Hispanic style or Latino style queso fresco. The people who are really most at risk are pregnant women and people with weakened immunity, whether that's from an illness that's causing poor immunity or medication or severe malnutrition. The risk for pregnant women is really to the fetus. It can cause fetal infection called granulomatosis infantiseptica, which, as it sounds, is a disseminated granulomatous infection with sepsis. And it primarily affects the fetus. And mothers may not have very many symptoms when they get sick, and the baby may still have may be born with sepsis or meningitis, or she may suffer fetal loss earlier in pregnancy. The types of foods that are safer for pregnant women and people with weakened immunity to eat are the hard cheeses, if they're made with pasteurized milk or if they're aged for 60 days or longer. And that's an FDA rule here. Soft cheeses, sometimes they can squeeze by saying that they've been aged more than 60 days, but they're really not made safer by aging if they're made with unpasteurized milk. For example, in France, they don't even allow sales of soft unpasteurized cheeses beyond 60 days. And any soft cheese, because of the possibility of environmental contamination, can be contaminated even if it's made with pasteurized milk. So people at risk should really avoid soft cheeses and cold cuts as well, deli meats, that sort of thing.
Sure. How is Listeria treated?
So Listeria is treated for people with who are at high risk and maybe have more serious infection with IV ampicillin and gentamicin, generally for 14 to 21 days. For mild disease, ampicillin may be used orally or even for trimethoprim sulfamethoxazole, but generally treatment for more severe infection would include gentamicin for a more extended course.
Gotcha.